Hello. Um, so I just wanted to say, first of all, thank you so much for expressing an interest in participating in the research that I would like to do. I'm super grateful to all of you who've expressed interest and indeed who will go on ahead and do that research activity with me. And I hope you enjoy that experience. I've certainly designed it so it can be an enjoyable experience, and I hope you get a lot out of it. I hope it leaves you educated and also feeling a lot better. So I thought I would start with a little bit of an introduction just to me, first of all. So I'm Jo Summers, and most of you have probably found me through the world of LinkedIn. So you can see quite clearly that I'm a former corporate career girl, and I've now given up that corporate career and I've retrained completely in crystal therapy and immersive meditation. Quite a change, but a very, very happy one. And I am now a fully qualified and insured crystal therapist. And there aren't many of us about. There's lots of people practicing crystal therapy, not necessarily qualified, not necessarily insured. But there are even fewer crystal therapists who have specialized in crystal meridian work in the way that I have. So the purpose of this video is primarily to introduce me so that you can decide if you would feel comfortable working with me. Because what I offer is energy work, ultimately. So if the vibe isn't sitting right with you, then I'm perhaps not for you. And that's okay. Please don't feel any angst about accepting that I'm not for you, or this isn't for you, and this isn't for you, or I'm not for you right now, because fighting that and resisting it will only disrupt your energy even further. And that's just not helpful, plain and simple. So hopefully this will give you a little bit of a feel of me and what it's like to engage with me, a little bit of a taster. But I also want to introduce meridians so that you know what they are, and as well as the process that I'll be taking you through for the purpose of the research that I'd like to extend, so that you can also decide if you're comfortable with that process too. So there's two things. Are you comfortable working with me? And are you comfortable working with going through the process? So meridians then. These are meridians. Let me just do a little bit of a screen share. So these are meridians, and on the left-hand side, you can see a front body view, and on the right-hand side, a rear body view. And the meridians always come in pairs. So whilst the diagram only shows the meridians on one side of the body, they are absolutely replicated on the other. Now, if you look at, for example, the arm, you can see that there are meridians that flow all the way down the front of the arm. But then when you look over on the right-hand side, you can see there are even more meridians that run down the back of the arm. Same on the leg, front and back, different. Same on the torso, front and back are different. So when you start to look at that, and again, there's a lot of meridian points go all around the head, in particular that start and finish around this part, and as well above your lip and below your lip. So the meridians cover the body so extensively. And I should hasten, I don't need you to get familiar with these meridians. Please don't think that you do. What I'm trying to do is just bring to life for you just how extensive the meridian network is. And the meridians that are on that diagram are the primary meridians. There are other circuits that are more localized to just the hand, for example, just the knee. But what I want you to understand is that no matter what your surgical procedure or injury has been, and there might be plural of them, you might have had surgeries or surgery and injuries, it's nigh on impossible for that procedure or that injury to have not caused damage to your meridians because of how extensively the meridians cover the body. Does that make sense in the first instance? I hope so. So I wrote my thesis for my final diploma, and the subject of it was the case for crystal meridian work in patients following surgery or injury. And I chose this topic because I had observed in both myself and through the literally hundreds of hours of case study treatments that I had to do as part of my qualification, that crystal meridian work was absolutely transformative in patients who had undergone surgery or who had, for other reasons, accumulated scar tissue. And I'm going to share with you, and I have permission to share, I'm going to share with you one of those clients. And she was a 9-year-old girl. And clearly she was treated with permission of her parents, but she had literally, she was a normal, healthy 9-year-old girl. And in the course of living her normal, healthy 9-year-old active life, she suffered serious soft tissue damage to her ankle, which meant she had to have it fully supported in a boot for 8 weeks. So it was pretty immobilized within that boot for the whole 8 weeks. And the reason I like this example is because it's so simple. And unlike most adults who've got a long history of other injuries, other surgeries, it really neatly isolates the issue and the solution without having to consider lots of other conditions, medications, environments, other factors. So this little girl started to develop asthma symptoms, which were initially just put down to her fitness had reduced during the 8-week period of wearing the boot. She'd just not been as active during that period. But the symptoms continued, the asthma symptoms continued long after the boot was removed, and she'd returned to all of her usual activities. And more by luck than anything else, her parents were aware of the work that I was doing and just thought it was worth asking the question. And what they didn't know then, but they very much do know now, is that the kidney meridian kind of does this loop through your ankle on both sides. And that the third meridian point, or the third kidney meridian point, is located in the ankle. So it starts underneath the sole of the foot and works up the body. But the third meridian point is located in the ankle. And that meridian point has for thousands of years been linked to breathing difficulties, what we now call asthma. But in a traditional Chinese medicine, they didn't have asthma. They just had breathing difficulties. So we did a little bit of work on that kidney meridian, in particular the third kidney meridian point, and over a period of weeks, continued that work, and she is now free of asthma. Simple, right? And I could go on with other cases like this, but I want to keep this video short. And really, the purpose of me sharing that case study is just to, my message is that issues which Western medicine would consider totally unrelated to a historic injury or scar are much more likely to be linked by a meridians therapist. Now, a meridians therapist could be an acupuncturist or somebody like me, a crystal therapist with a specialism in meridians. But people who bridge that gap, that Eastern medicine, traditional medicine gap, are much more likely to take that connection. And what I'm looking to do is to take that one step further. So in my thesis, I conclude that crystal meridian work is definitely an option for patients who've undergone surgery and should be considered, and it's in their best interest and would improve their outcomes. Lots of evidence to support that, not just through my case studies, but through nuclear physics, all kinds of different things. But I have to conclude that there are not enough crystal meridian therapists or acupuncturists combined to keep up with demand if we were to be supporting literally the thousands of patients who undergo surgery each day or who visit A&E for stitches or soft tissue damage. So what I'd like to do is consider a templated approach. So you've probably seen physios use this. So if a patient has a knee replacement, a physio will have a standard set of exercises that they will give to that patient, printed out leaflets for them to take home. But there are a standard set of exercises for a patient who has undergone that procedure. And they might need to be adjusted to factor in other issues that a patient has got to consider. But the notion is that 80% of patients, 80-20 rule, 80% of patients will be absolutely fine using the standard exercises. And those standard exercises have been risk assessed as safe for the patient to complete at home, to complete having undergone the procedure, and to complete unassisted, and it's known and understood that they will build strength and flexibility and stamina over time. So my logic is, well, what if I could do the same for crystal meridian work? What if I could come up with some templated solutions to suit different types of surgery? And that's why I'd like to expand my research still further, and why I'd like your help and contribution in doing so. I'm going to leave it at that in terms of explanation. I don't want to completely blow minds, but probably the next big question is, what's involved for you? So I will need to spend about 1 to 1.5 hours on a Zoom meeting with you to take down your full medical history. And I'll be asking you, I'll be looking at it along a timeline, and I'll be asking you to assess levels of wellness at different points along that medical timeline. Now, depending on your medical history, and it's not uncommon for people who've had one surgery to have and then had multiple surgeries, especially if they're an adult who, you know, like me, I'm pushing 50. I've got a fair few surgeries under my belt as well. So sometimes that's why it needs the 1.5 hours. All of that information will be securely stored in line with GDPR, and you can make an appointment to have that conversation with me outside of your working hours. That's absolutely fine. And then really, that's all of your hard work done. We'll then arrange a treatment time for you, and we'll reconvene by Zoom, so everything is done remotely, so that I can do a crystal meridian treatment for you. You just need to be somewhere quiet and comfortable, so not really lunchtime whilst you're in the office environment. I actually recommend that you try and do this at night, so that you can then, or in the evening, so that then you can get yourself off to bed afterwards, because then the treatment, the energy will continue to do its work and enhance the work whilst you sleep. So this part, you should just find this to be a really relaxing and enjoyable experience. I don't expect you to experience any pain, any discomfort, any nightmares, anything like that. It should be a lovely, relaxing and enjoyable experience for you. I'll be keeping in contact over the next day and week rather, just via a messaging app. Now, I prefer WhatsApp because it's more secure, but if you don't use WhatsApp, we can just agree a different messaging app that you're comfortable with. But I'll just keep in touch with you over the next couple of days following your treatment up to a week afterwards, and just check in with how you're feeling, as much because that's just good patient aftercare, but also so that you can make me aware of any changes that you're experiencing and ask me any questions. And I will also check in with you in about 2 weeks' time and a month's time as well. And that will just be a quick WhatsApp message or other messenger service to suit you. But it will just be a very quick one. And you can reply at your leisure. I don't need an instant reply. You can wait till the weekend. You can wait till you've finished work. You can wait till children have gone to bed. It's all flexible to suit you. That's it. That's it. I fully expect that you will have lots of questions as we go through this process, and I fully expect that you'll probably want to know more, and that's absolutely fine. What I may do is then convene some kind of seminar for you all to pose those questions to me, do some more learning. If that's what people want, if that's what people need, I may just do it one-to-one with you via WhatsApp. Not quite sure how that will pan out yet, but suffice to say that if your curiosity is piqued, you've got me on a subject about which I am well and truly passionate. So I will not be able to resist answering your questions. So I will be able to do that. And really, that is absolutely it. And I hope that sounds simple, painless, and I hope it inspires and gives you some hope that potentially there's an opportunity for you to improve your wellness and feel a little bit better, because that's my desired goal and outcome for anybody and everybody that I work with. And that's what brings joy to my life, quite honestly. So let me know what you think if you'd like to go ahead. And then I'll send you my Calendly link so that we can get you booked in for that initial consultation. Speak to you soon.